Hello, I'm Dr. Swati Naik and once again welcome on MQR AICOG TV live from Bhubaneswar. I'm privileged to have with me the father figure of the obstetrics and gynecology and one of my favorite teacher, Professor Dr. C.N. Purandare sir. I don't think any one of us need an introduction of sir because he is so well known not only in India but across the globe. He is the president of FIGO. So thanks for joining on our studio, that is MQR AICOG TV show. Thank you so much. Sir, a lot of controversy is going on the obstetrics care, particularly with respect to the labor. In terms of how do we do the labor, it's a normal labor versus a cesarean section. What's your opinion on that, sir?
Well, if you look at what the current scenario is, that worldwide the cesarean section rates are going up. Some for good, some not so good. If you look at the cesarean section rates in Brazil, for that matter, in private practice the cesarean sections are nearly 85%. In India the overall cesarean section rate is about 17.2% annually, and it varies from city to city. WHO said that they should be between 10 and 15 to reduce maternal mortality. That doesn't mean that cesareans can't be done for other situations as well, and the cesareans which are done in most of the places, lot of the times is because of various issues. There are medical legal issues, there are issues of currently women getting pregnant at the age of 40 because of their working, also by IVF and so on. So the situation has changed drastically from what the 1985 thinking was to today in 2018, and you have to move with the times to see really what is happening. But unfortunately in the middle portion, the fear of instrumental delivery causing problem to the baby through the instrumental deliveries out of the practice of new trainees of obstetrics and gynecology, which would mean that either somebody had to deliver very easily normally or had to go to a cesarean section. Now nothing is 100% safe, whether you are talking about cesarean section or you are talking about instrumental delivery or even for that matter normal delivery. Problems do happen and they can happen at a minute's time. It's not something which you can predict a lot of the time, and they just happen. And because of that, the people now feel that cesarean sections are safer than doing instrumental vaginal deliveries, which is a wrong assumption. And I think the time has come when the whole generation of obstetricians who went through training, who have lost the art of doing instrumental deliveries, need to retrain themselves to make sure that they're reviving the art of obstetrics. But unless we do that, the cesarean section rates are not going to come down. And I keep on telling everybody, a time will come otherwise that patients will either deliver by cesarean section or vaginally accidentally because there is nobody there and they just deliver, and there is nothing available and they just happen to deliver vaginally. Otherwise everybody will deliver by cesarean section. So I think we need to introspect from both the sides to see whether women who are demanding cesarean sections need to be educated as well, and the obstetricians in the other hand really need to retrain themselves to make sure that they are able to reduce the cesarean section rate by doing various other procedures as well. We have forceps deliveries, one-tooth deliveries, the new Odon device which is now going to come in to the market for delivering vaginally. Unless you use all these things to cut down the cesarean section rate, it will keep on climbing. If the women feel that no instrumental delivery should be done at all, a valuable tool in the hands of the obstetricians will go out of use, and that is not going to be good for the women at large, because look at the cesarean section rates causing placenta accretas and complications, subsequent pregnancies, not able to deliver vagina, everybody going in for a repeat cesarean section. There was a time when people said once a cesarean section, not always a cesarean section. But the situation has come that once a cesarean section is becoming always a cesarean section, which is a very disturbing trend as far as cesarean sections are concerned. And I think today's obstetrician need to really look at to make sure that the normal 37 weeks plus pregnancies which go into spontaneous labor are delivered naturally and normally as far as possible. And if that is done, eventual total cesarean section rate from cesareans happening this way or even repeat cesareans will go down because the initial delivery has been a normal delivery. So we need to really retrospect and study and see everything, and today FIGO has put down guidelines regarding how to bring about the change in cesarean section rate, and especially the 10-point Robson's criteria, which is now accepted worldwide and is the FIGO's recommendation to make sure that the cesarean sections rate is brought down, and I would reckon that WHO in 2015 has also said that there is no definitive number that can be put. What was said in 85, today's scenario, no definitive number can be put as for cesarean section. Woman who needs it must have it, but the question is she should be needing it. Those who don't need it should not be having a cesarean section. That is where the bottom line is.
Absolutely. So the normal labor should be attempted in maximum cases, and when it is in need, then only the cesarean sections are justified. That's what we can conclude, sir. Thank you so much, sir. Apart from the FIGO guidelines, is there something FOXI guideline coming up for this to arrest the cesarean section rates?
Well, FOXI probably will follow what WHO and FIGO's guidelines have now been accepted by WHO. The WHO guidelines have also come out. And as I said, they have categorically said that a woman in need must have a cesarean section. There is no number. Unfortunately, the 1985 10 to 15% which was written by WHO is quoted by everybody, with the politicians and general public and women, that it should be 10 to 15%. If you bring down that to 10 to 15%, the maternal mortality and perinatal mortality will rise. And I mean, if you look at what FOXI did as a survey and ask the obstetricians themselves and doctors' wives, how many of them had cesarean section? It's over 50% opted for cesarean section, which if you are talking about a doctor wanting a cesarean section, you're talking about a doctor's wife being offered a cesarean section because they can, there is no money here exchange, there is no money transaction. People feel that obstetricians do cesarean section because they are getting more money, and there is no money being exchanged here because doctors don't charge doctors, but yet the section rate is over 50%. So if you think that that is the right treatment to offer, then it should be offered to everybody. Why not that treatment be offered to public at large, and whatever is needed is to be given, and that's the way one looks at it. And FIGO has actually put in recommendations which I think all the obstetricians must start following, that the charges for normal delivery and cesarean section, the obstetrician charges should be same. Nobody should say that you are charging more for cesarean section. Of course, the normal delivery charges will go up because of standardization, that will happen. But look at it that way, that if a doctor is delivering normally, is there for 10 hours looking after the patient, while it's only 20 minutes cesarean section is over. So the charges should be same. If 25% section rate is accepted by any obstetrician in his, I'm just giving an arbitrary figure, then the number of deliveries that the person is doing per year, standardize and say, these are my charges. You can come and deliver with me, these are my charges. Where you like it, you don't like it. If you don't like it, go to somebody else. It's like the choosing what is the best, and you feel that this particular individual is giving the best service, then you pay for the services. It's a professional charges, and it's not you pay lawyers, you pay anywhere else, everybody, you don't question that, and you only question that doctors should not charge money. Are they supposed to live off the beggar's bowl on the road to collect money to eat and do social service? Has spent so many years of life in educating, learning to become an obstetrician. I think due respect should be given to the both situations, and you can't be saying that well, as a doctor you are a humanitarian grounds, you should not. If you look at the doctors who by and large the entire lot, they have given free service in hospitals. I worked for 20 years as honorary professor giving free service in government hospital. Everybody is doing that, and there is no question of service being not offered. But what is their due? If you grudge doing the giving the due as saying that they are doing it for the sake, I don't accept that.
Sir, I think in the interest of the patients and the society at large, we all should encourage a normal delivery and cesarean section only when needed. I think under your able guidance and with Foxy and Figo, in future we would definitely get those promising change again from the cesarean section towards the normal delivery, which is the most physiological for the benefit of the mother as well as the baby and for the society at large. Thank you so much, sir, for joining us. It's always a pleasure to converse with you, to take your blessings and guidance. Thank you so
very
much.
much. I
Thanks,
enjoy being at AICOGs. Every single AICOG I have attended, being in Foxy for many years now, and being in office bearer for many years, and then the president of Foxy, and then going to Figo at this stage. And it's indeed a pleasure to be here.
Thank you so much, sir. We at MQR really salute you for your contributions and your dedication. We have got so much from you through the field of obstetrics and gynecology. Thank you so much.